закладку.
Угу.
Так, строчками. І ще робимо. Зажав.
Спасибо.
This phobia has arisen because of some people's fear that medical care will not be of high quality, but doctors are ignorant and will behave negligently. The fear of injections is characteristic of people who were born and raised in the countries of the former USSR. That is more of a Soviet disease, although trypanophobes are found in all countries of the world, only there are fewer of them. The behavior of these people is accompanied by a very great fear of the syringe. They cease to control themselves. There is no logic and panic begins for fear. Just a reminder of the injection or a syringe. Trypanophobia is partially or fully observed in almost 20% of the population of the former Soviet. According to psychologists, the spread of the disease is not based on high levels of medical care, nor on the tactical treatment of some doctors and other medical staff by patients. It is very bad for trypanophobes. It is very difficult for them to provide medical care, for example, donate blood for analysis or inject anesthesia for pain relief, etc. And they categorically refuse any injections, even when the disease threatens their lives. The cause of such a phobia should often be sought in childhood. The fear of injections in children is formed from some parental conversations such as, "If you do not listen, then I will call a doctor and he will give you an injection." Who did not hear this in childhood? From their parents or from others. That is, parents often form a phobia on their own in front of doctors and medical treatment. For example, "I am not a trypanophobe, but there is little stress before the injection and I bend during the injection." At the subconscious level, this fear is present in all people, and only in some of them it turns into a phobic disorder. Another cause of fear may be generic memory. Also, the cause of the phobia may be when a person saw a needle pierce the body, and different options from this, for example, the fear that the needle will break and remain in the body, or the appearance of a bruise or tumor where they have injected. However, there are people who have suffered from an inept and unskilled injection. They can also become trypanophobic. How to treat? If it is a severe form of the disease, then without a professional psychotherapist and antidepressants cannot do, the simpler forms of the disease can be overcome by this phobia or deceive it. For example, do not follow the nurse who is injecting. Distinguish at the moment of injection. Listening to music or meditate. Also, humor and laughter is the best therapy. Joke with your doctor or nurse, and so on. If you liked it, then you like. I will not give up financial support for the development of the Ukrainian channel. Details in the description of this video.